Well, good evening, everybody. I hope you can hear me okay. I'm Commissioner Darren Seeley from the Bureau of Human Resources. I appreciate you taking the time to join us tonight. There's a few more people that are registered than we've got in the session right now. But because you all have gotten here and it's 7 o'clock, I'm going to go ahead and get started. We'll cover a lot of information over the course of the next 30 minutes or so. On your screen, there's a Q&A button. If you have questions, you can click on that button and type them in. We will work to, if they're relevant to what we're talking about right at the time that we're talking, we'll try to answer those. Otherwise, we'll get to them towards the end as well. Any question is okay. We'll do our best to answer those. And any question that we can't answer, we'll get you some information on how you can get a hold of us tonight to do that. With me this evening is Michelle Deomendi. She is part of the BHR team, and she'll respond to some of your questions very likely via the Q&A text while we're going. So hopefully we can get everybody fully informed tonight. And with that, we're going to dive in to what we've got going on. So every year, the employee health plan was facing continued increases due to the rising costs of healthcare and prescriptions, which led to continually modifying coverage to accommodate these rising costs. And over time, deductibles have increased and modifications have been made to help manage those costs. And our goal in this change was to provide better value and overall coverage and allow employees to have more options to choose a plan that best fits their needs. With over 12,000 employees across all parts of state government, one plan definitely does not fit everybody. So we also received some feedback from employees that voiced concern or desire for more meaningful well-being programs. And those we've put in place hopefully will help people achieve their well-being goals in the coming years. So how we got here is that we formed a group was formed to including internal staff from BHR, consultants, advisors from large employers inside and outside of South Dakota. We hired a consulting firm to provide market research and best practices, and they assisted with employee surveys and focus groups. Over 53% of state employees shared their thoughts through that survey, which was a really great number. Really happy with that. And employee focus groups provided us with some more in-depth comments and feedback that really helped shape what these plans and improved benefits look like. The team worked with many scenarios and to come up with what we believe is the most economical and beneficial program for the majority of state employees. And through our process, we explored a wide range of options to deliver the best plans to you. After all the meetings were held, it was determined that delivering streamlined and simplified coverage while also giving more choices in plan design would deliver great benefits to our employees. And from there, we started looking at what the offerings were from other companies and what services they offered. After months of discussions, research, and an RFP process, it was determined that Wellmark, Blue Cross, and Blue Shield would give state employees great coverage along with a wide network both within South Dakota and throughout the United States. The way the state plan is currently structured, the state was responsible for contracts with individual providers across the state. With Wellmark's broad network, we anticipate that discounts will be better for nearly every service with Wellmark, which will result in cost savings to you and your families as you buy products or use services. While the new plans do impact each employee differently, we strive to find the best solutions for our employees who live throughout South Dakota. With 4 plans to choose from, individuals can use Alex to help navigate the plans and discover which offering is the best fit for you. Age banding was removed to simplify rates and make our plans more comparable to what is available on the market today. And simplifying our plans allows our proactive health management that can respond to trends. Over the last several years, the value of our plan has decreased. The new plan puts value back in and offers stability while still being affordable to our employees and to the state. Premiums on the higher value plans allow for more sustainability. The new plan is structured to ensure financial viability for the long term, pardon me, with planned reserves. Access to a broad network of providers was highly important. We wanted to minimize disruptions to the patient-provider relationship, and we feel we've found that with the Wellmark Blue Cross Blue Shield network. Our new plan allows for market-based benefits that keep us in line with organizations of similar size, with other governments, and with the private sector in South Dakota. During open enrollment, you'll have upgraded benefits system and an employee self-service portal. And Alex will be updated with the new plans and be ready to assist you in mid-March. Our previous plan was complicated and included juggling dozens of contracts. Our new plan will simplify the health and wellness experience, for employees and reduce administrative burden. With fewer vendors and utilizing the extensive Blue Cross Blue Shield network, employees should notice a more streamlined experience. With the introduction of Wellmark, we're able to take advantage of their broad network savings and negotiated rates, allowing the state to reinvest. The proposed budget includes using $12 million of these savings to invest in employees' salaries, in addition to what is requested in salary policy. We anticipate nearly every employee would see some increase from this depending on the funding provided. The addition of employee premiums to some of the plans has allowed the state health plan to offer enhanced benefits and choices to employees, in addition to providing more stability to the plan in the coming years. A few examples of the additional enhancements include the cost sharing on dental insurance premiums and the addition of annual covered eye exam for each member on our health plan. And even though our plan is self-insured, which means that the state assumes the financial risk or responsibility ultimately of the plan and all associated benefits, we need a partner to administer claims, payments, and negotiate network discounts with healthcare providers and facilities included in our plan. Wellmark, Blue Cross and Blue Shield of South Dakota will be the administrator of our benefit. Wellmark is based in Sioux Falls. Currently, about 386,000 South Dakotans have their health insurance or their health coverage through Blue Cross and Blue Shield. In fact, they're the largest health network provider in South Dakota, and 1 in 3 Americans is covered by Blue Cross Blue Shield. Members of the state employee health plan's new options will enjoy access to a broad range of hospitals, primary care, and specialist docs, as well as telehealth benefits offered through Wellmark. And Wellmark covers 98% hospitals and facilities in the United States. Employees will see better access and deeper discounts if they reside outside of South Dakota or anytime they travel outside of South Dakota. And we will be keeping prescription drug coverage through the CVS Caremark relationship. So we're excited to share these 4 plan options. Keep in mind, of course, that everything is contingent upon approval of the legislature, and with many changes, we want to get as much information to you as soon as we could. However, that does put us in a bit of a predicament of not being able to say with 100% certainty that this is what the final outcome will be until we do have that final approval. We encourage you to stay connected to us and the updates to the plans as more information becomes solidified on our social channels, website, and by looking at our monthly BHR newsletter. So before we start talking about the 4 health plan options, I just want to take a few minutes and kind of make sure we're level set on a few terms around health insurance. The first is coinsurance. And coinsurance is essentially your share of the cost of covered healthcare services or prescriptions, calculated as a percentage. So once you've met your deductible, you pay 25 or 30% of eligible expenses, depending on the coverage, until the out-of-pocket maximum is met. A copayment, on the other hand, is a fixed amount, say $50, and you pay that for a covered healthcare or prescription benefit, and usually right when you receive that service. And the amount can vary by type of covered healthcare service and does not count towards your deductible, but does count towards your out-of-pocket max. Then the deductible, that's the amount you pay for most covered services before the health plan starts to pay. So the deductible will not apply to all services, and particularly those preventative services like annual exam. And then, of course, the out-of-pocket max is the most you must pay for covered services in a plan year. And after you spend this amount, between all the other things, deductibles, co-pays, and co-insurance, the health insurance pays 100% of the cost covered by benefits. And the out-of-pocket max, of course, does not include your monthly premium. It's for the things you spend for services and products. So again, just want to remind you before I jump into the next slide that you have the opportunity to ask some questions through the Q&A. Feel free to do that as we go along here. But I will keep going. So an in-network provider is a provider who's contracted with the health plan and the flex benefit provider to provide services to you at a discount. So a flex benefit provider meaning an eye doctor or a dentist, for example. And then an out-of-network provider doesn't have a contract with either the health plan or one of those other services. And when you go to an out-of-network provider, your benefit may not be covered or may be covered at a lower level. So you'll want to make sure to know exactly who's in and who's out. You may be responsible for all or part of the bill if you use an out-of-network provider. So a health savings account, or HSA, they're governed. It's a savings account governed by the IRS, and there's a lot of rules that apply to participating in this particular piece of our program, and they're not BHR based, they're IRS based. So the health savings account is a savings account that enables eligible members enrolled in a high deductible health plan to contribute pre-tax dollars to a savings account to help pay for eligible medical, prescription, dental, and vision expenses. You can only contribute if you're enrolled in a high deductible plan. And then contributions can be made to this account from you and from the employer, us. And the money is always yours. Once it's in your account, it's your money, and it rolls over from year to year. So the question from Mackenzie is, since our insurance starts over mid-year, are we still able to max our HSA total from January to June? So the max total for your contributions is going to be annual, and your contributions through the benefits, co-pays and out-of-pocket maxes, et cetera, are on a plan year. So your HSA will always be maxed out on a January to December number. Good question. An FSA, or a flexible spending account, medical flexible spending account, also governed by IRS rules, and it's an employee-only contribution. So you can put money in, we cannot, and it allows you to put pre-tax dollars to a savings account to pay for eligible medical, prescription, dental, and vision expenses. It's a use it or lose it account, and you can have up till September 14th of the current plan year to incur claims, or if you leave employment claims incurred while you have active benefits. And they can be used with a low deductible plan very easily. And of course, they can also be used with an HSA in certain instances, but an HSA is easier. And then there's a health reimbursement account, again, also governed by IRS rules. And it's an employee only. Hold on one second for me. So the health reimbursement account is an employer only account. So we can contribute money to it and you cannot. And so it allows that pre-tax dollars go in, we put money into the account, and if it's used for medical expenses and dental, vision, et cetera, there's no tax to you to use that account. The money does expire though as part of the plan year. Sorry, I jumped ahead too fast. So it's not put into an account and then there like a health savings account forever. Essentially, it's put into an account as you submit claims and are reimbursed. So the new health program offers 4 plan options. The Washington plan has no employee premium, and every plan offers unique features from an all copay plan to a no co-insurance plan, and then two plans with copays and co-insurance with different deductibles. So let's jump in here and talk a little bit about the Washington plan. This again is the no premium plan for employee only coverage, but does include preventative services at 100%. So it also continues to offer preventative drug copays for selected drugs. And then of course, this plan does not have co-insurance. You'll pay the full cost of prescriptions, the office visits, medical services until the deductible is met. And then once, and you pay those at the negotiated lower cost network savings rates from Wellmark. So if you're on a plan like this, where you're paying most of the costs up front for yourself or your family member, when you go and purchase prescriptions or go for medical services, you can expect you'd see lower bills because of the savings that the Wellmark negotiated rates bring to us. So the Washington plan is a high deductible health plan, and it is HSA compatible if you qualify. And to be an eligible individual or to qualify for an HSA, you have to be covered by the high deductible health plan, not enrolled in Medicare, and you can't be claimed as a dependent on someone else's 2019 tax return. There's a few other qualifications as well. So make sure that you talk to a tax professional so that you don't end up in the wrong spot with the IRS on tax time. And then just to make sure you, to remind you, your yearly preventative exam is not subject to deductible, and the plan covers the cost at 100%. So we don't want you to be putting off any important health screenings and getting those annual checks. And then of course, this plan features an embedded deductible. So the Jefferson, Lincoln, and Washington plans all have an embedded deductible. And I want to talk about what is an embedded deductible a bit and how it works. So we're going to use the Flintstone family to illustrate how this works. Fred, Wilma, and Pebbles have a family deductible of $11,000 and an embedded individual deductible of $5,500. Fred breaks his toe driving his car to the quarry and meets his $5,500 embedded individual deductible. The plan from that point on then will pay 100% of covered healthcare and prescription costs for the remainder of the year for Fred. So far, Wilma then has met a $4,000 deductible, leaving a remaining unmet family deductible of $1,500. That remaining deductible can be met by any combination of expenses for Wilma and or Pebbles. So once that deductible is met, the plan would pay 100% of their covered healthcare costs for the remainder of the year. So it works quite a lot differently than our current deductible does. So as we move through the next three plans, each plan would have an employee premium, and sometimes we'll refer to those plans as a buy-up option. And this simply means that as the plans begin to offer more coverage, such as a lower deductible, a copay, and other features, employees may choose to purchase or buy up a higher level of coverage. And premiums have been set to fit those additional coverage levels. So the Lincoln plan is a high deductible plan, but with a lower deductible than the Washington plan. And after deductibles have been met, employees pay a co-insurance or a cost share of 25% of covered charges until reaching the out-of-pocket maximum. And this plan does cover preventative services at 100%. And so your deductible does not need to be met to take advantage of those early preventative exams to be fully covered. The Lincoln plan also features an embedded deductible. And again, it's a great option because our prior health high deductible plan, the full family deductible had to be met before the plan started to pay co-insurance. And certain preventative drugs are still available with copay in the Lincoln plan, and some generic preventative are still at a zero cost. Like the Washington plan, this is HSA eligible. And because these are both high deductible plans, they are compatible with that health savings account, assuming you're eligible. And if you or your covered spouse complete the wellness qualification before April 1st of 2021, you receive a $500 contribution to your health savings account at the beginning of the plan year in July of 2021. If employees who are not eligible for an HSA can choose one of the low deductible health plans and receive the health reimbursement account, or choose a high deductible plan and decline the HSA if you choose. The Jefferson plan is the first of the 2 low deductible plans. Now, the Jefferson plan has an employee premium and features a lower deductible and offers copays and coinsurance to help you plan your costs a little better. Just to clarify again, coinsurance is the share of the cost you cover for health services or prescriptions, calculated as a percentage. So after you reach your deductible, the Jefferson plan will pay 70% and you would pay 30% until you reach your out-of-pocket max. The copay, of course, being a fixed amount. So for an example, an office visit has a $50 copay for a primary care practitioner. And a primary care practitioner in our definition includes the general practitioner, an OBGYN, a PA, or a PRN, and they don't include specialists like a dermatologist, an oncologist, a cardiologist. Also, chiropractors are considered a primary care practitioner. So preventative services in this plan are also covered at 100% with no cost share from the employee, and you can put money into a flex spending account pre-tax to pay for qualified medical expenses. And then the Roosevelt plan is a unique plan design that has no deductible. It's an all copay plan. Each covered service, such as an office visit, urgent care, ER, even surgeries, has a set cost associated with it. For example, on this plan, a primary care office visit will cost $30. For more details about that plan, see that plan design matrix on the new plans page. This plan is for people who want to take away many of the surprises that come with healthcare costs. And preventative services are still covered at 100%, and prescription drugs are all copays as well. Now, the plan does not have coinsurance, so when you hit your out-of-pocket max, the plan pays 100%. The plan also allows you to make pre-tax contributions to that flex spending account to pay for out-of-pocket costs. Eligible preventative care is covered at 100% when you meet age and frequency requirements. So examples of that would include scheduled immunizations and vaccinations, pregnancy care, preventative screenings, annual wellness exam, cancer screening procedures, and well child care. To be covered by the plan, preventative care services, including those immunizations, must be received from a participating provider. So for a complete list, you can see pages 69 to 76 of the summary plan description. That's a hard thing to probably remember, but you can search what is covered as preventative care by the Affordable Care Act, probably in Google, and you'll find it pretty quickly. When we talked about copays for primary care providers, we received a question. Does this mean I have to designate a primary care doc to receive the service at the copay amount? And the answer for that is no. For purposes of the copays, primary care physician refers to that general and family practice and internal medicine, the OBGYN, pediatricians, nurse practitioners, and PAs. Non-primary care practitioners are specialists, dermatology, oncology, cardiology, et cetera. And so they'd have a higher copay for those services. So keep that in mind. These plans are still designed so that you may not be able to tell you today what specific provider copay will be, but by the time we get close to open enrollment, we'll have that fully defined. The question from Hallie is there an embedded deductible in all plans? And the answer is yes. Every one of the plans has the embedded deductible, and it's a huge advantage over our current plan structure for folks who are covering more than one individual on their plan. Good question. So like all low deductible health plans, these 2 plans are not compatible with the health savings account. However, you can elect to participate and set money aside in a flex spending account, or flex savings account, sometimes called, to help budget for costs and take advantage of cost savings, because that would be pre-tax money. Additionally, if you and a covered spouse complete the wellness qualification before April 1st, you'll receive a reimbursement of up to $500 in a health reimbursement account to offset costs during the plan year. And in our old structure, current structure, the qualification is a barrier, if you will, to get into the low deductible plan, and you couldn't get any, extra money contributed if you went into a low deductible plan. That bar is removed, and now you can get up to $500 in that health reimbursement account to offset real expenses that you've paid as part of your healthcare needs in a year. So a quick glance at the premiums for each of the 4 plans. As we mentioned earlier, the Washington plan has a 0 premium for the employee only coverage. And then you can choose additional coverage with one of the other plans that may fit your family or your individual situation better. So again, we're working through legislation. And so once we have a finalization of what's happening, every bit of this plan would be as we see it here, or completely different that we haven't talked about at all. So if you have questions on if a provider is in the Wellmark network, you can go to wellmark.com and click on the Find a Provider at the bottom of the page. And then you can see on the screen here, you enter the 3 letters, ZYH, so that you can see where those docs are before we're actually in the Wellmark network. So again, they cover 96 or 98% of all facilities and physicians in South Dakota, and 96% of facilities around the country. So odds are really good that the person you're seeing today in South Dakota is going to be somebody that's in the Wellmark Blue Cross Blue Shield network. In addition to the change in the from Wellmark, Blue Cross and Blue Shield, and the 4 new plan designs, we're excited to talk about some additional enhancements. So our 2 dental plans are staying the same in terms of coverage. The dental premiums will now include a cost share of $16.20. Employees on the enhanced plan would also see that same cost share. So we'll show you how that impacts things on the next slide. Health plans will now include a covered eye exam, and eye exams are not just about vision. Eye exams can often reveal other health concerns and serve as an early indicator. So while vision exam is covered under the medical plan, remember that it does not include other costs with eye needs like frames or contacts, et cetera. So as you're choosing, think about your needs and your family's needs associated with those things, but you can also set aside money into a HSA or into a flex spending account to help offset some of those out-of-pocket needs and maybe avoid having to pay an additional premium. So flex benefits such as dental, vision, and others will continue to be available to employees even if you opt out of health coverage as they are today. So again, you can see a change here real quickly in what the premium will look like for dental with that 50% of the employee-only coverage being covered by the state. A pretty good savings, and hopefully allows people to who are not currently taking advantage of dental to get dental coverage. So Wellmark members have access to additional benefits to help support you and your family as well. So Be Well 24/7 offers access to health professionals to answer health-related questions 24 hours a day, 7 days a week. And then of course, Blue 365, it's a portal that offers access to discounts from things like fitness trackers and memberships to other kinds of sporting equipment and apparel. So a good place to help enhance your healthy lifestyle at a little bit better price. And then the My Wellmark portal allows you to track your healthcare costs and gives you some tools and resources at your fingertips and see everything about what's going on with your coverage and your health in one place. So the benefit well-being programs offered as a benefit to employees, and tools and resources are provided to help improve your overall well-being, focusing on physical, mental, social, emotional, and financial health. Your health screening can be used to evaluate risk for a variety of health issues, many of which can be prevented through early detection and lifestyle changes. The screening is totally optional, but there is an incentive for participating, and the screening qualification is the only activity required to earn the incentive this year. So that $500 we talked about, all you need to do is either complete the health screening, and if you cover a spouse, your covered spouse, either go through the health screening if you've done it, those are over for the year, or you can go to your primary care physician and take the form off the BHR website and have that completed and submitted, and you get the $500. Recommend to do that early so that we're not pressed up against that deadline and you might miss out. And I think I just covered that. So you get it once you've submitted, either your screening is complete or you submit your primary care physician form. You'll get an email that lets you know that you have qualified, to try to make it a little easier for you, so you don't have to chase down and try to get a hold of us. And again, you have Jackie. It's 500 total, regardless of your enrollment type. So the question is the $500 to the HSA or HRA per person, and it's total. But I'll tell you a little bit more here in a second about how you can earn some additional money. So employees hired or spouses added after July 1 are not required to complete this year, are not required to complete this in order to get the incentive. You get kind of a year freebie right now. So if you complete that health qualification, you'll be eligible again. If it's by April 1, you'll be eligible for that incentive at $500. If you select the low deductible plan, you get receive a reimbursement up to $500. And so what you would do there is you submit a cost to Discovery Benefits, which their name will be changing to WEX here shortly, but same company, same accounts, so that you submit, say you you paid a bill for $250 at the doc, you submit that and you get reimbursed $250. If you select a high deductible plan, you could receive that $500 in a health savings account. So a lot of information out there on a webpage at bhr.sd.gov about HRA and HSA accounts. Prescription cost, the question from Sarah is, do prescription costs count towards the deductible in each plan? And the answer is, if you're in a high deductible plan and you're not paying the copay, it counts towards deductible. Everything you pay will count towards your out-of-pocket max. So if it's a copay, it doesn't count towards your deductible. If it's non-copay, it does. And then Hallie, I think, is asking about whether or not the HSA or the HRA can be used for prescriptions, and the answer is absolutely yes. Let me make sure I've covered everything here. Yep. So we're excited to share that in July, we'll launch a new wellbeing portal, and it will be customized based on your individual needs. So the portal will have challenges, informative articles. It'll sync with your tracking device and integrate with other health benefits or other benefits. So there will be an opportunity as well to earn some additional incentive through the wellbeing program. And that incentive is up to another $400, whether you're covering one person, just you or more, if you complete some of those challenges. So an opportunity to get up to $900 in either health savings or through a reimbursement account by taking part in some activities regardless of your coverage level. There's a question that I don't know the answer to, so and I apologize that I don't know. My instinct is the answer is yes. The question is, can the HRA be used for hearing aids? And I believe the answer is yes, but I'm not 100% certain. So we will follow up. And if you, it says anonymous attendee. So if you want to send us a note or tell us what your name is, we can follow up with you personally. We can also add it to the FAQ page.
Actually, Darren, I know the answer to this because we had this question just a couple days ago, actually.
Good.
And the answer is yes, you can use that money for purchase of hearing aids. They are eligible to use that money for hearing aids.
Awesome. Good. So a few key takeaways here as we kind of get to the end of my talking, and we'll, if you have questions, and still, please feel free to start typing those in. We'll try to get through them. So, our new plans are offering great choices for employees to choose a plan that that best fits your family's needs. And so we believe the process has been simplified. Our previous plan was very complicated and included juggling of dozens of contracts. And our new plan will simplify a health and wellness experience for employees and reduce the administrative burden. So allows for proactive health management. It'll help us respond to trends in the employee population. The program is sustainable. So over the last several years, the value of our plan decreased, and the new plan puts value back in and offers stability while still being affordable to you as employees and to the state. So the new plan is structured to ensure financial viability for the long term. Our plan is market-based. It keeps us in line with others, organizations of similar size and other governments, and with the private sector, but at lower prices than what you'd find in the general marketplace. Our new plan also allows for enhancements that provide you with extra savings on dental premiums and access to more tools, information, and resources at Wellmark, discounts through Wellmark 365, and our content to improve your overall health on our enhanced well-being portal. We're continuing to invest in our employees' overall well-being by offering a preventative eye exam included in that medical plan, adding an employer cost share to allow a more affordable way to get dental care. In addition, we're offering employees the opportunity to earn a wellness incentive regardless of the plan that you're on, and the completion of the wellness qualification is no longer required just to get into that low deductible plan. So if you have a current account with Discovery Benefits, and I mentioned this earlier, the account will stay the same, but the name will change. Discovery Benefits was purchased by another company called WEX, and so that name will change, but your account information will not. I want you to make sure you keep an eye out on things as we continue to move forward. We're adding more information to websites. New video will be coming out soon to talk about that embedded deductible a little more in depth. So please keep an eye out on things. I want you to make sure you watch your inbox and your email, online, social media. Probably be some things getting sent home occasionally. And then, of course, that new Alex experience is being developed to make sure that you can account for all 4 different plans, as well as some things like your risk tolerance to help you make a better, more informed choice. So, and then just mark your calendar, kind of start to plan ahead. Open enrollment will be May 3rd through the 17th. And because we're having all these new benefits, you will have to go online and enroll. The enrollment selections for dental, vision, and the health plans will not roll over because they aren't exactly the same as they have been. So if you don't participate in open enrollment, you'll automatically be enrolled in the Washington plan or the free plan at employee-only coverage. So we want to make sure that you go in and enroll, because we will not cover automatically anybody other than you. And any flexible benefits also, of course, are not going to roll over. So that's the end of my presentation. I want to, there's a couple questions here. The first one, will condition management programs still be available? They will still be available. Yep. We're working with Wellmark to redesign what those look like and how we interact to try to make that a more streamlined process and react more quickly to the needs of employees. So there will be some things and more coming on those things soon. And then there's a copay question with a primary care appointment. Would you pay the primary care copay, then have to go get blood work at the same appointment? Is it still a primary care copay, or are you billed separate for that? So I'm going to stop there for just a second and say, most likely, you would probably have 2 copays in that scenario, unless the blood work and things were part of the preventative service. So it all kind of comes down to how that provider documents what they did. And so when, if those things go wrong and you think you didn't get something, we can usually, if the provider did something incorrectly, we can get those changed. But generally speaking, if you're getting blood work for something that isn't preventative, it's probably going to have a second set of costs. If you have a dermatologist and would pay the non-primary care copay, then I have to get a small procedure done while there. Do I pay the outpatient copay, or is that covered under the non-primary copay? I'm so sorry. So that is a similar answer to the question. If the dermatologist, says, let's say they take off something real small and easy, and they just call it a visit, you would likely see that non-primary care copay. If for some reason they had to do something a little bigger, they may do 2 billings. So it will be up to basically how that doctor codes what they did, will determine that outcome. Other questions?
We have one in the chat.
Okay.
Will certain preventative medications, BP meds, be available at no cost?
Yes, certain preventative drugs. Basically, you can probably assume that the vast majority of those generic preventative drugs that you get for free today would be free July 1. So because it's generally the preventative generics that are free, we would expect that to be the same going forward. A question about, is counseling considered primary or non-primary? I believe, and Michelle, if you've had this question and know the answer, I'll let you chime in here, but I believe that the answer is it is primary under the counseling services because of the behavioral health parity question. So I believe it is considered primary care. Any other questions, comments, anything you'd like to know? So if you have questions or things that you want to know, or have very specific questions about your healthcare and these changes, I would suggest, you feel free to give us a call at BHR. And Michelle, what is the email address for for benefits that they could send questions to?
Oh, I just had it should be benefitswebsite.sd.us.
Okay. And that way somebody can get back to you quickly with any questions that you have specifically. I'll wait another couple minutes. If there are other questions, feel free to type them in. I'd be happy to answer those. Again, I really appreciate you taking the time to come and spend some time with me. The only thing I don't like about this is I don't get to have any conversation with anybody. It's kind of odd. So appreciate your time, and hopefully we'll be out soon doing some of these things live and get a chance to interact a bit too.
And I do have a correction on that. I forgot one part of that website.
Okay.
Benefits website at state.sd.us.
Okay, so it's the email benefits website at state.sd.us.
Yes.
All right. Well, thanks again, everybody. Have a great night. Stay warm and safe this weekend. Will you be mailing employees a guide is a question, and the answer is we're working on a digital guide, and we will do like we did last year. If people want a printed version, we will get those sent out to them. So we will provide an opportunity for that to happen. Any other questions?
Oh, well, that's nice. We got a thanks.
Well, thank you. I appreciate your time.